Hello, my name is Ravi Kumar and I'm a first year student of a Kaznmu and my group is ZM20451A. Today I discuss about some of the topics like first aid of an urinary retention and catheterization, for bleeding and for burn and frostbite. Let's discuss about the first aid of the urinary retention. Urinary retention is a condition in which your bladder does not empty completely even if it is full and you often feel like you really have to urinate. There are two forms of urinary retention, acute and a chronic. Urinary retention affects both man and a woman. Anything that blocks the flow of urine from your bladder can cause acute or a chronic urinary retention. A sudden and a complete obstruction causes acute urinary retention. A slow, progressive, partial obstruction causes a chronic urinary retention. Causes of an obstruction common in both man and a woman included like that urinary tract stones, urethral strictures, a mass or a cancer in your pelvis or intestine, severe constipation, a blood clot from a bleeding in your bladder, a foreign object inserted into urethra, severe inflammation of the urethra. Like the first treatment or the first help to provide a patient, like the acute urinary retention is a medical emergency and your doctor will quickly place a catheter into your bladder to let out the urine. This is the quickest and easiest procedure. Some of the medicines can also be used, like amphetamines, antihistamines, muscle relaxants, and non-steroidal anti-inflammatory drugs, and a pseudoephedrine, etc. And the last procedure, like the quickest procedure, is catheterization. Let's see how to perform a catheterization. Generally, clean the opening of urethra and spread the lubricant on the one end of the catheter and insert the lubricated catheter tip into urethra and advance the catheter gently until the urine begins to flow. Allow urine to drain completely into a toilet or a urine receptacle. Once the urine stops flowing, gently withdraw the catheter. In this diagram, we show the female and the male reproductive structures and in which representation of how to use a catheter. Let's see, our next topic is first aid for bleeding. Types of bleeding can be represented in image here. For several bleeding, takes these first steps and reassure the injured person. Like first, remove any clothing or a debris on the wound. Don't remove large or deeply embedded objects. Don't prop the wound or attempt to clean it yet. Your first job is to stop the bleeding. Wear disposable protective gloves if available. Stop the bleeding. Place a sterile bandage or a clean both on the wound. Press the bandage firmly with your palm to control the bleeding. Apply a constant pressure until the bleeding stops. Maintain the pressure by binding the wound with a thick bandage or a piece of a clean cloth. Third, help the injured person lie down. If possible, place the person on a rug or a blanket to prevent a loss of body heat. Calmly reassure the injured person. Fourth, don't remove the gauze or a bandage. If the bleeding seeps through the gauze or the other cloth on the wound, then add another bandage on the top of it and keep pressing firmly on the area. And the 5, use the tourniquets. A tourniquet is effective as controlling a life-threatening bleeding from a limb. Apply a tourniquet if you are trained into how to do so. When emergency help arrives, explain how long the tourniquet has been placed. Last is 6. Immobilize the injured body part as much as possible. Leave the bandages in a place and get the injured person to an emergency room as soon as possible. Call 911 or emergency medical help for severe bleeding that you cannot control. In this image, the representation of some of the related information about first aid for treatment of wounds. Our next topic is first aid for burn. Generally, we have some of the steps like stop the burning immediately. Put out the fire or stop the person's contact with a hot liquid, steam or other material. Help the person stop, drop and roll to smoother flames, and remove the smoldering materials from the person, and remove the hot or a burned clothing. If the clothing sticks to skin, cut or a tear around it. Second one is remove the constructive clothing immediately. Take off the jewelry, belts and tight clothing. Burns can swell quickly. Some of the steps like that: cool burn, protected burn and treat pain. Some of the steps are we discussed here. Like in the cool burn, hold burned skin under cool, not cold, running water or immerse the cool water until the pain subsidized. Use a compresses if running water is not available. And generally cover with a sterile, non-adhesive bandage or a clean cloth. Do not apply a butter, oil, lotion or a cream, especially if they contain fragrance. Apply a petroleum based ointment 2 to 3 times per day. Treat a pain. Last one. Give over the counter pain relievers such as acetaminophen like Pandol and Tylenol, and ibuprofen like Advil, Morphine, or a naproxen, Alve and naproxen. Some things do's and don'ts during a burning. Like do's, like remove the cloths on the burned area or cut around it if the clothes are stuck to the burned area. And place the affected areas under running water for at least 20 minutes to cool down the burn. And place the affected areas under running water for at least 20 minutes to cool down. Okay. Don'ts. Do not use ice or ice water to cool down the burn. Do not use home remedies like toothpaste, oil or a soy sauce to cool down the burn. If any blister form, then do not try to burst them. Our next topic is, and the last one is, first aid of the frostbite. Frostbite is when the skin and underlying tissues freeze after being exposed to very cold temperature. The areas most likely to be affected are the fingertips, toes and earlobes, cheeks, chin and the tip of the nose. Early signs and symptoms of a frostbite are patches of a reddish skin and burning pain. The condition that progresses to cold, numb, white or a greyish skin that feels stiff or look waxy. You can treat the mild frostbite like frost nip yourself. All other frostbite requires a medical attention. First aid steps for frostbite are as follows like that. Check for hypothermia. Get an emergency medical help if you suspect a hypothermia. Signs of hypothermia they include intense shivering, drowsiness, confusion, fumbling hands and slurred speech. And protect your skin from further damage. If there is any chance the affected areas will freeze again, don't thaw them. If they are already thawed, wrap them so that they don't freeze. Get out of the cold. Once you are in a warm space, remove a wet clothes and wrap up in a warm blanket. Gently rewarm the frostbitten areas. Soak the frostbitten fingers, toes or other extremities in a warm water 105 to 110 Fahrenheit, about 40 to 43 degrees Celsius. If a thermometer is not available, test the water by placing an uninjured hand or an elbow in it. It should feel very warm, not hot. Soak for 20 to 30 minutes or until the skin becomes its normal color or loses its numbness. For the face or ears, apply a warm wet washcloth. Don't rewarm the frostbitten skin with direct heat, such as a stove, heat lamp, fireplace or a heating pad. This can cause burn. Drink warm liquids like tea, coffee, hot chocolate or soup can help warm you from the inside. Don't drink alcohol. Consider a pain medicine. If you are in pain, consider an over-the-counter pain reliever. Now what to expect as skin thaws? You feel tingling or a burning as the skin warms and normal blood flow returns, and take care to not to break any blisters that may form on the affected skin. Seek a medical help for anything more serious than mild frostbite. Frostbite images, some of the representation shown in this image. Thank you for watching this presentation.